Hello, everyone, and thank you for joining. We're just going to give it 1 or 2 minutes before we get started. Thanks. Well, I do want to be mindful of everyone's time, so I think we're going to go ahead and get started. First off, hello, and thank you for joining the National Safety Council and the Health Action Alliance for this discussion on safely expanding operations, how the Delta variant may impact workplace reopening and safety protocols. My name is Malcom Glenn, and I'm an advisor to the Health Action Alliance, and I'll also be serving as your moderator today. And for folks who don't know, the Health Action Alliance works to accelerate the business community's response to COVID-19, advance health equity, and rebuild public health. We provide companies, both large and small, with free resources, training, and events that help them deliver trusted, fact-based health communications to employees and encourage consumers to make informed decisions about COVID-19 vaccines. The Health Action Alliance was founded by the Ad Council, the Business Roundtable, the CDC Foundation, the de Beaumont Foundation, and the Robert Wood Johnson Foundation. And thank you to all of our founding partners for all their support in helping bring together this and so many other events like this. And I'm really excited to chat with you all today. And I'm so excited that you've taken time out of your busy schedules to join us, because we do really have a great group of speakers here to discuss a topic that I really don't think could be more salient considering where we are in the pandemic. But before we jump in, a couple of quick housekeeping notes before what I suspect will be a really engaging conversation. And so throughout the conversation today, we also want to make sure that we're hearing from you. And so I absolutely encourage you to use the Q&A feature to submit any questions that you may have for any of our speakers today. I'll be monitoring the chat, and we'll make sure to leave some time before the end of our hour together to take some of the questions from all of you. And in addition, we will be sending out a follow-up email with a recording of today's event for all of you who have taken time out of your day to join us today. So why have we convened this group of experts, along with all of you, here today to talk about how employers can safely expand and, in some instances, reopen their offices? Well, it's because we find ourselves in something of a precarious place in our ongoing fight against COVID-19. You know, on one hand, we have almost 60% of American adults who are fully vaccinated against COVID-19. And across the country, I'm sure you all see, restrictions have largely been lifted almost everywhere. And the CDC says that fully vaccinated Americans no longer need to wear masks. That's great news. On the other hand, the CDC is also reporting that the Delta variant, a more transmissible strain of COVID-19, now makes up more than half of all new infections in the United States. Now, the good news is that, according to the CDC, COVID-19 vaccines continue to offer a high degree of protection against the Delta variant. But the bad news is that the federal health officials warn that the variant does still pose a, quote, significant threat to unvaccinated people, especially in areas of the country where vaccination rates are low across the community. And it was just reported yesterday that as many as 46 states are seeing rising numbers of COVID cases. And this is largely due to the Delta variant in unvaccinated communities. And so this surge because of the Delta variant comes at a time when many businesses are considering if and when they're going to bring employees back into physical offices and workplace settings. And at a time when many retailers and businesses, as I'm sure you all seen, are already fully reopened. And this is all with the knowledge that we have from the CDC that there are still 1,000 US counties that have vaccination rates below 30%. And COVID-19 transmission will likely increase, as we've seen over the last couple of days and weeks, in areas as the Delta variant keeps spreading. Meanwhile, the US is starting to struggle a little bit in terms of putting shots into arms. Vaccination rates fell about 85% in the last 3 months from the peak. And there are still more than 80 million unvaccinated adults in the United States, notwithstanding, of course, children under 12 who still aren't yet eligible to be vaccinated. And so all of this is to say that there are a significant number of people out there who are still vulnerable to COVID-19. And so it's with that in mind that we've organized today's session to help employers navigate that path forward, to help you understand the public health, legal, and other considerations that you'll need to keep in mind as you make important reopening decisions to protect the health and safety of both your workers and your customers. And so we at the Health Action Alliance have been really focused on this, and we have a set of resources available to all of you as you think about reopening your offices. You can find all of those resources at healthaction.org/resources. And today, actually in partnership with the National Safety Council, we've launched a new interactive decision tool for employers to answer the important questions that come up about how to safely reopen their workplaces. And I will touch a little bit more on that really exciting tool before we reach the end of our hour together. Okay, so without further ado, I want to introduce you to all of our amazing panelists that have joined us today. These 4 folks are each subject matter experts on topics ranging from masking guidance to managing hybrid and mixed vaccinated workforces, to what the emergence of the Delta variant is going to mean, to OSHA's emergency temporary standard, to a bunch of things related to business operations. So I'm going to briefly introduce each one of our panelists, and then we're going to jump right into questions. So first off, we have Dr. Lisa Waddell, who is the Chief Medical Officer with the CDC Foundation, which, as I mentioned, is one of the wonderful founding partners of the Health Action Alliance. In her role, Dr. Waddell manages the Foundation's COVID-19 response efforts, including directing the team of senior advisors who are providing support to health departments across the nation, and the COVID-19 core surge staff that was hired as part of the response. Before joining the CDC Foundation last year, Dr. Waddell served as Deputy Chief Medical and Health Officer and the Senior Vice President at the March of Dimes. I'm also pleased to be joined by Rich Fairfax, who is a Principal Consultant with the National Safety Council. Rich is a former Director of Enforcement Programs and Deputy Assistant Secretary for OSHA, a role from which he retired in 2013. And we're so pleased to have his insight and expertise now with the National Safety Council, as well as his presence on the panel today. Not to be confusing, but we have another Richard. Richard Cerenzio is a Senior Technical Director at ISN, focusing specifically on corporate health, safety, environment, and security. Prior to joining ISN, Richard spent 18 years in global HSEQ senior management. He also serves on the National Safety Council's SAFER Task Force and various Campbell Institute work and discussion groups. And last but not least, we have Chuck Palmer, who is a partner with the law firm Michael Best and Frederick LLP, where he leads the workplace safety and health practice. And during the pandemic, his team helped the nation's largest canned food vegetable brand, along with the FDA and CDC, avoid a shutdown of our nation's vegetable planting, harvest, and pack. So really, really important work. He also assisted one of the largest providers of equipment and translation services to the deaf and hard of hearing community to continue to operate safely, and helped move more than 50% of their translation technicians to home-based work, permanently changing that business model, probably for the good. And so I just want to say thank you to each of our panelists today, and let's jump into the conversation. So if you don't mind, Dr. Waddell, I would love to start with you. I mentioned as we started off the emergence of the Delta variant, and we're seeing so many different things on the news about what it means. Is it more transmissible? Is it more likely to result in worse outcomes for people if they contract the Delta variant? So I'd love to hear from you, an expert in the public health field. What does the surge in this variant mean for the next phase of the pandemic? And how can employers navigate that path forward? And Dr. Waddell, you may be muted, so you might need to come up.
So,
I can hear you.
First, good afternoon or good morning to all of you. Thank you, Malcolm, for the invitation to join today. Certainly the CDC Foundation, a nonprofit organization, is really pleased to partner with the Health Action Alliance and welcomes the opportunity to share important information with all of you assembled here today. So yes, let's dive right in. I first want to say that this really is a pivotal moment in this pandemic. And we have to keep in mind that over 607,000 people have died as a result of this deadly virus in this country. And we know many, many, many more people have been impacted either directly or indirectly through families and friends. Now, the good news is, I think Malcolm has highlighted, is that we have made a lot of progress over the past few months, the past year. And that's happened because of collective action, the collective action of individuals, organizations, large and small, communities that make up all different types of individuals and entities, important programs, policies, innovations, and of course, businesses of all type that are likely represented on this call today. So the key is that we keep moving forward. We don't want to fall back after all of this hard work that everyone has put in. This virus has proven over and over again to be deadly, and it's sneaky because it knows how to change, it knows how to mutate, and we have seen that happen. And we are living with that right now with this Delta virus. So what does this surge and this variant mean for the next phase of the pandemic and how employers should move forward? The goal is the same. We all have to stay focused on preventing the disease and saving lives. It's clear that this Delta variant is of great concern. The Delta variant is naturally occurring mutation of the SARS-CoV virus that causes COVID. The data shows that this variant is more contagious and spreads more easily. We are seeing that it is really impacting a lot of young adults. And we have concerns about children under the age of 12 because they are not yet vaccinated. We see now that this variant is accounting for a growing proportion of the coronavirus cases across the US, now accounting for over 58% of the cases. And just 2 weeks ago, that was 31%. So we can all see what's happening, right? The variant, again, has been shown to be particularly dangerous in those that are unvaccinated. So as a result, people are infected with the variant are more likely to need hospitalization. And we're seeing that play out in the news right now. We're seeing that play out in communities where vaccination rates are low, and we're seeing the hospital surges starting to happen. So vaccinations are really the key. Data show that the COVID-19 vaccines are extremely effective in protecting fully vaccinated people from catching and spreading the virus, including this Delta variant. So for a business perspective, it's really important to continue, and or to start if you haven't been, really helping to support your employers in getting that vaccine, making sure they've got the information that they need and how to facilitate them getting the vaccine. It's critical to just stay up to date with information because things are changing and they change rapidly. And then based on the pandemic and the progress of vaccination steps, we'll have to potentially, do things differently. I think it is important to recognize, though, that we have mitigation measures that have been working, and it's important that we don't throw those out. We need to use this layered effect. And so the piece around masking is still really important because we have so many folks that are still unvaccinated. So vaccinations, prevention, vaccinations, and continue to utilize these important mitigation factors because this Delta variant is very, very serious.
Thank you, Dr. Waddell. And I really appreciate you bringing up mitigation factors, right? Because so much of the conversation feels like it's shifted almost exclusively to vaccines over the last couple of months. And I think it's important for us to keep in mind that those mitigation factors really do still matter. And it's with that in mind that Richard Sorrenzio, I'd love to bring you into the conversation. So taking that into account that, we know where the vaccination numbers are, we know that everyone going into a workforce isn't necessarily vaccinated, and we know that we have these mitigation efforts. So if you're a business, why would you want to actually continue masking policies? Would love to hear your thoughts there.
Sure. Thank you, Malcolm. Thank you, everyone on this call. For us, and we have a unique challenge that I'm sure some of you have. We have 12 offices in 5 countries, meaning that there's different regulations, different rules, different speeds of easing of recommendations. But for us, we continue with the masking. To Dr. Waddell's suggestion, you don't throw out the good practices that have been in place. So we keep with masking for non-vaccinated employees. We keep for social distancing for all employees. We limit conference rooms. We limit, the attendance in each room based on, we don't segregate vaccinated from unvaccinated, but we bring everybody together. It is on an honor system of, if you are vaccinated, you don't need a mask. But it also works towards the mental health aspect. We do surveys constantly of our workforce, and we make sure that what we hear consistently from all cities and all countries is there's some people who are uncomfortable and want to be home, yet there's some people who do want to come back to the office. And those people, just for mental health reasons, to see other people. We have a typically, all evidence to the contrary with my picture here on the screen, but we have a young workforce, and they want to get out. They want to come to the office. They want to meet with their supervisors, and we've made it voluntary since we could start bringing people back. But yeah, the wearing masks and the social distancing, that has never gone away throughout any of our 12 offices, even when it started in Australia, before things started to turn back the wrong way, where they could do pretty much anything they wanted to do at one point. We still kept a company policy of keeping those in place to just make sure, back again to Dr. Waddell, that we don't go backwards in this. We've done 19 months of this. We're all tired of the work we've done. We want to get to that end of the tunnel, and we don't want to take 2 steps back at this point.
Yeah, thank you, Richard. And it's such an important point, this notion of continuing to move forward, right? To not lose the gains that we've made as a result of these mitigation efforts and the vaccine efforts. But the reality, I think, is that there's still some employees who say, well, if I don't have to wear a mask because the CDC tells me I don't have to, or because I'm vaccinated, I'm not going to do it, even if my employer tells me to. So Chuck, I'd love to ask you, when you're thinking about a mixed workforce where some people don't want to wear masks and some people do want to wear masks, if you're an employer, how can you practically enforce masking policies within the workplace?
Yeah, so thanks, Malcolm. This has been a real challenge for many employers, and most employers have gotten away from the 100% masking just as a practical matter. But that creates quite a difficulty, because then you've got this dual citizen population where some are wearing masks and some are supposed to be wearing masks but are not, and others have been vaccinated, and according to the CDC, they can take their masks off. Certainly an employer has a right for safety and health to enforce rules. If you wanted to have a 100% mask requirement and continue to do that, you certainly have a right to do that. And that's an easy thing to enforce, because if you tell everybody to wear their masks, then you can enforce that. And from a safety standpoint, you have a right to do that. Most employers are not doing that, and they are going with a varying degrees of enforcement as it relates to the CDC commentary that those who are unvaccinated should still be wearing masks. Some are just saying they're allowing everybody to take their masks off. Some are saying sort of a don't ask, don't tell approach to it, which is we're gonna say to you that you must wear a mask if you're unvaccinated, but we're not going to enforce it as a practical matter. Others are asking for an attestation form from employees to say that they've been vaccinated and that they will follow distancing and all the other protocols. Others are actually asking for a copy of the card. And then some are mandating vaccines. Certainly in healthcare, you'll see a lot of that. And Rich will talk about that with respect to the ETS. So there's these varying layers of enforcement. You really can't enforce it if you don't know who's vaccinated and who's not. So I would say that the majority that I see now are more in the don't ask, don't tell reality. And initially the discussion was you're going to have to do some kind of an enforcement, but as communities have lowered the enforcement in restaurants and bars and so forth, most employers have a feeling that, well, how am I going to enforce this when everybody's allowing people to go around mask-free, whether vaccinated or not? And what are the chances that somebody can establish that it actually occurred at my workplace? But what OSHA has come out with is new guidelines, and we still have the general duty clause. So from a legal standpoint, you still have a duty to maintain a safe workplace for your workers. And so what I've instructed employers or advised employers on is that just because you decide to go with a don't ask, don't tell approach, there are still other measures that are in those CDC guidance that are then incorporated into the OSHA guidelines. So masks aren't the only thing. There's about 7 categories that I would look at, and masks are one of them, but social distancing, hygiene, air handling, distancing, I have that on there twice, because I think that's an important one, and barriers where you can't distance, and then screening people at the door are all other steps. So if you're going to decide not to really enforce the mask requirement for unvaccinated people, you should still think about all these other steps to meet your general duty, because OSHA is going to be looking at what other things are you doing besides just masking. So that's where I think the real struggle comes, is how do we enforce this mask mandate for unvaccinated people, or mask requirement for unvaccinated people? And I think some employers are going to fall on one side or the other of those various degrees, but then consider all those other steps.
I think that's really helpful guidance, Chuck. And I think it's also useful as folks heard you talk through all of the different considerations that employers have and what other employers are doing, and not really knowing kind of where they fall. And you also mentioned OSHA's emergency temporary standard, which is in some ways helpful guidance to employers who are a little bit confused as to how they should operate. And it's with that I want to bring Rich Fairfax into the conversation. Rich, of course, you're a former leader from OSHA, spent a number of years there, and are an expert in this space. So for folks in the audience who don't know, can you just describe what OSHA's emergency temporary standard is, and then perhaps give us what the top takeaways are from the ETS?
Sure, happy to. OSHA, interesting, when OSHA was developing the standard, they actually developed 2. One covered all industries and the other one covered healthcare. And I mean, clearly they went with the healthcare coverage under the emergency temporary standard. Now it's interesting, and a lot of people don't realize this, but the standard is actually in effect. It went into effect on the 5th of July, so it's in effect now. I think one of the biggest takeaways on the standard, and I get a lot of calls from people that think they're not covered by OSHA now that there's an emergency temporary standard if they're not in the healthcare industry. And I'll just add on to what Chuck was saying. He made it very clear, so I won't say a whole lot, but OSHA has the general duty clause, which is a requirement for employers to provide a safe and healthy work environment. They have personal protective equipment standards. They have respirator standards. They have housekeeping standards. They have hygiene standards. So if you're not in the healthcare industry, don't for any means think you're not covered for COVID, because you are. There are a lot of existing standards, and everyone else is covered by those standards if there's employee exposure. And OSHA has a national emphasis program focusing on COVID, and some of the industries identified in that are, meat packing, food processing, warehousing operations. So OSHA, just to be clear, is looking at a variety of other industries. So the standard itself applies to healthcare, but OSHA is still requiring a lot of requirements for other companies. The other, I think, big takeaway with the standard is that if you're covered by the emergency temporary standard, the big point in the standard is you have to have an exposure control plan or a COVID plan or an infectious disease plan, whatever you want to call it. You have to have some sort of plan in place. And most of the industries in healthcare already have a infectious disease plan for bloodborne pathogens. And what I'm telling people, if you've already got a bloodborne pathogens exposure control plan, model the COVID one on that, and then reference the standard for the different elements. So just to be clear, there's a standard for COVID in the healthcare industry, but then there's all these other existing standards that apply to other industries. So
Thanks, Rich. And I think there are two things that you just brought up that are really important. First is this notion of making a plan, the importance of employers actually making a plan about how they're going to deal with these situations. And then the second thing you said was sometimes drawing upon previous plans, not thinking that you have to start from square one. And it's with that in mind that I'd love to ask you a question, Dr. Waddell. We have learned a lot. Employers have learned, we have learned, folks like you in the public health world have learned a lot about what type of outreach works when it comes to the vaccination effort. And I think there's some things that we can learn from that effort that can help inform the way that employers approach the return to work effort, right? And so would just love to hear a little bit from you about what we know about employer actions that have been effective in encouraging vaccines or simply making it easier for workers to get vaccinated when otherwise they felt like they didn't have access to vaccines.
That's great. So yeah, again, employers are such an important part of our community infrastructure. So again, your focus on prevention is really key. And employers have taken a number of actions to help educate their team members about COVID vaccines, as well as providing the opportunities for folks to get the vaccine. And interesting enough, Kaiser Family Foundation recently published an update to a report that they periodically put out. And they talked about how 2/3 of workers report that their employer is encouraging vaccinations, and half say that their employer is providing paid time off for workers to get the vaccine and recover from any side effects. And that those actions appear to be having an effect. About 3/4 of workers whose employers encourage them getting a vaccine or offer paid time up say they've actually gotten at least one shot. So the key point here is the importance of policies that are supportive of the employers. So policies that allow your team members, your staff to have that time off without any penalty to actually get their vaccination. It's important that they also are supported to have that kind of time off so that they can get their children, their adolescents vaccinated. And then when the children under the age of 12 are eligible, that's going to be really important as well. And then sometimes they are going to have some side effects. And so for them to be able to have that support to appropriately recover. In some cases, there may be employees that could use a little bit of support for other out-of-pocket expenses, such as transportation to get to the location. So there are things like that that you can do. Certainly, we all have heard about all different types of incentives that different entities are offering. And I think the jury is out on that, but certainly if you do think about incentives, it's important that it's not something that comes across as coercive from that perspective. So really the policies around the paid time off seem to be really important for employers and employees.
Thank you, Dr. Waddell. And I appreciate you mentioning how important it is for employers to support their employees, right? To really provide space and opportunity and access to get vaccinated. And I think in our experience at the Health Action Alliance, we've absolutely seen the degree to which those levels of support have really improved vaccination efforts within certain companies. That said, though, there are still, in many instances, going to be people who, for whatever reason, choose not to get vaccinated, even with tons of support from their employer. And so, Chuck, in situations where that's the case, where the support is there, the companies are doing the right thing, but you still have folks who are not getting vaccinated, how can a business make sure that they're not, sort of accused of discriminating against a group of unvaccinated workers versus vaccinated workers?
Yeah. So let's break down that word discrimination. So, certainly there are protected classes of individuals who have perhaps a disability or a religious belief that that's against vaccines. And so there are some discrimination aspects to this as it relates to those categories of religious or disability. And you have to be aware of that, because certainly if somebody is immunocompromised and their doctor tells them they shouldn't get a vaccine, there shouldn't be punitive repercussions for that individual choosing not to get a vaccine. Nevertheless, I would say that if that person is in the workplace and is not wearing a mask, that there's a double whammy. They're not vaccinated and they're immunocompromised and not wearing a mask. So you still have the right to enforce safety protocols. Same thing with a religious objection to vaccinations. And so as long as your procedures are focused on the safety and not punitive for those individuals who are raising a protected category of placement from the EEOC perspective, as long as that's not punitive, you have a right to enforce and require those individuals to wear a mask. It gets a little bit more challenging if an employer says, for example, if you're not vaccinated, you may not return to the workplace. And an individual cannot compete in the workplace and market who's immunocompromised and can't get a vaccine. And so employers may have to accommodate that. And the accommodation may be those safety things, distancing and masking and air handling and many of those things to be able to accommodate that person back to the workplace. But generally speaking, beyond that religious and disability protection, the fact that I choose not to get a vaccine does not make me protected under the law as a category of individuals that have rights to refuse to wear a mask, and you have a right to enforce those, and frankly, maybe a responsibility to do so if you look at OSHA's guidance and CDC guidance.
I think that's really helpful, and I think the legal guidance is pretty clear. But Richard, I would love to hear from you about kind of what do you do? You understand the legal ramifications, but what do you do in terms of morale? Ultimately, you still are going to have this sort of mixed vaccinated workforce, and would love to hear from you about how you encourage employers to handle those type of situations, and perhaps what have you done in those types of situations in your experience at ISN?
Sure, and what we do, we started, Malcolm, by setting up, God bless SharePoint. We in SharePoint, we have folders for each city where we have vaccine information available to all employees. We let them, they're aware of where they can find that information. We keep it updated daily, so it has the right information. We don't have biased information in there. Yes, we do want people to get vaccinated, but we're not out there banging a drum to say, get vaccinated, we're at 82% or whatever we are. We just keep that information, so hopefully they can make a common sense decision to go out, and if they read the information, hopefully go out and get vaccinated. In our company, we did say that you can take your mask off if you are vaccinated. We are not asking for proof, but we do say we reserve the right to ask you separately if you are vaccinated. We haven't used that, nor do I think we will use it anytime in the future. But we do, again, educate people to vaccination. And again, not to get vaccinated, but hey, as a reminder, we have this folder where you can go to get this vaccine information. We also, Dr. Waddell mentioned PTO before, and our PTO, I mean, we're not a clock punching type of office. You know, I mean, people come in, they do their job, they go home. So we're very flexible with PTO, with people who want to take the time off. We don't separate and say, we don't incentivize and say you get, 3 hours of pay for going to get your vaccination or anything like that. They just do what they need to do, and they're going to get paid for their workday. I mean, we don't count hours here. But that being said, we speak to people, we give them the information, we have meetings, the surveys that we've been doing, and surveys through the NSC, surveys that we've developed in-house, they've been the most valuable thing that we've done, because that keeps us on the pulse. And it's amazing that in 12 cities, we ask the same questions, yet what happens in Dallas, where we have the majority of our employees, is completely different than the feedback we get in Auckland, or we get in London, or we get in Mexico City. And we have to be ready to address, you know what I mean? We can't just blanket everybody's having the same concern because the Dallas office has that concern. You have to be very specific with those offices and how we're going to deal with masking, with vaccinations, with social distancing. So we stay very up to date with that. And I think it's so far, knock on wood, proven very successful for us.
Yeah, I appreciate that. The challenge that employers have, both staying up with up-to-date information, managing the differences across their workforce, and sort of all of the additional complications that come with that. Rich Fairfax, would love to bring you in kind of to build off that point. We've talked about so many different types of solutions, all sorts of ways that employers can approach these types of questions. So if I'm an employer, right, and I'm looking to, I want to put together a plan for my business, and let's say, just for the sake of argument, that I am a business to which the emergency temporary standard does apply, what kind of guidance would you give to employers about actually implementing that plan and doing it effectively? And again, just for the sake of the argument, assuming this is a company where the ETS is relevant.
Sure, I'm happy to. And on the previous conversation, I just want to add real quickly, the EEOC has some really good guidance and documentation dealing with, employers and vaccinations and returning to work. You can just look up EEOC and COVID-19, and the guidance, I think, is quite good and quite clear. So as far as a plan, if you're a covered industry and you already have a bloodborne pathogens program, I would reference that. Some of the key points is, unless you have 10 employees or fewer, the plan has to be in writing. If you're developing a plan, OSHA makes it really clear that you need to share it with your employees and involve them in the preparation of the plan. You also need to make it available to them. So if anyone wants to see it, they can see it. Other points OSHA is expecting is that, like bloodborne pathogens, they want the company to designate a person responsible for the infection control or exposure control plan, and they want it to be reviewed periodically. And unfortunately, they don't define periodically, but most people look at that as an annual sort of review. But the plan should address screening of people coming onto the site. The plan should address vaccinated versus unvaccinated workers. It should address what you expect as far as personal protective equipment, what you're going to do as far as training, what you're going to do as far as providing personal protective equipment. The plan does expect, if you have a requirement for respirators and you're a covered facility, that you have a respirator protection program in place. Now, fortunately, because of COVID and the need for respirators in certain industries, OSHA has actually backed off on all the required elements of the plan. You still have to train, you still have to show people how to don and doff a respirator, but you don't have to do the fit testing and you don't have to do the medical assessment. Other points the plan should address, barriers. It should address social distancing. It should address procedures for screening employees that aren't vaccinated that come into the site, or visitors or other people that might come onto the site. So it basically asks employers to do a risk assessment and then put the procedures and processes in place to make sure that those working on site don't have exposure.
That's really helpful, Rich. And I'll just add a couple of things to what you said. We at the Health Action Alliance, Rich mentioned EEOC guidance. We have actually put together a fact sheet that helps folks interpret some of that EEOC guidance, and got some really great help from the National Safety Council in order to put that together. And that's on our website at healthaction.org/resources. But I also want to transition to some really practical scenarios. And thank you to everyone who's tuned in, because you all have submitted some really fantastic questions as to how we deal with sort of practical situations. We've talked very theoretically, what do we do if X happens? And so I'm going to start to pose a couple of these questions to each of you on the panel, and whoever would like to chime in, feel free. But I want to hear a little bit about how we deal with these very specific situations. And so the first question is from someone who tuned in, who says, if one who is immunocompromised received their first shot of a 2-shot regimen and then contracts COVID-19, resulting in health complications, that was traced back to the workplace, to what degree is the employer liable?
Well, since that's a liability question, Malcolm, I guess that probably heads over to me. And the employee is likely covered by the workers' compensation program for the company. Now, workers' compensation is regulated by state law, so you may have different results in other states, but generally speaking, the contracting of COVID-19 at the workplace would be likely a disease covered by the workers' compensation policy if the employee can establish that that indeed is where the individual contracted the disease. Some states may vary on that, but for the most part, workers' compensation is probably going to kick in. And again, in workers' comp, the exclusive remedy available to the employee in almost every state, and Texas has some variations in terms of opt-in or opt-out of workers' compensation for some employers who choose not to be in the workers' comp system. But by and large, the limited liability to an employee for workplace illness or injury is workers' compensation benefits.
I'll just add on, if you don't mind, from OSHA's perspective. I mean, if an employee contracts COVID and it is a work-related exposure and the employee that contracted COVID is hospitalized, that's a reportable case to OSHA, and they're required to report it within 24 hours.
And I'll jump in there real quick, Rich. If the individual dies, they would have to report it within 8 hours. There are some interpretations out there. Initially, OSHA came out and said, hospitalization needs to be reported. But since then, when you're exposed to a hazard that leads to hospitalization, you're required to report that with, if that hospitalization occurs within 24 hours. So if that person was exposed and then got sick within 24 hours, then they would have to report that. But practically speaking, most people don't get sick within 24 hours of the exposure to the illness. So, before you report that, you may want to look a little closer at the timing on that. And there may be a situation where you wouldn't have to report that. So, timing is everything, as they say. And that certainly is the case with respect to reporting to OSHA hospitalization due to COVID. If they die, if that individual that's immunocompromised dies, then you've got 30 days. If that death occurs within 30 days of the exposure, then that would be reportable too. So we had a lot of these during the pandemic and had to evaluate those hospitalizations and those deaths in that context and look at the timing, because once you report, you may get an inspection.
If I may, Chuck and Rich, I have a question as an employer to both of you, and that's with how do you make the determination that the exposure was work related? I mean, in Dallas here, we're wide open. I mean, stores are open, restaurants are open. I have a younger workforce that's out on the weekends, out at night. And yet, yeah, I mean, how do I make the determination it happened in my office? I'm not looking to hide it by any means, but I'm just asking, how do you, we're stumped on how to make that determination.
Yeah, you're stumped and a lot of people are stumped. So that's a very legitimate question. What OSHA would expect as an employer with an employee that came down with COVID and they're not sure where they got it is you have to exercise due diligence and do, really the best you can to try to track it down. You may come up with in a gray area and you just don't know. And when that happens and people ask me, I advise them to, document all that you've done to track it down, but go ahead and report it to OSHA. A lot of people might disagree with that, but I think it's better to be safe than sorry. But you have to exercise due diligence and do the best you can. I think OSHA, OSHA is going to be fair, I believe, and realize that in some situations you just don't know. But if you have people that you've identified as positive in the workplace and they're working near somebody who then comes down with COVID, that leans a little bit towards it being work related. So Chuck?
Yeah, I think that's excellent advice, Rich. It's not, there's not a bright line as to causation, and it's fact specific. It was probably a lot easier early on in the pandemic when everybody was, staying at home or shut down, where a person could say, hey, I only went to work and home. Nobody in my house had it. But the person that worked next to me in the workstation next to me did. That proof was a lot easier to achieve. But now that everything's opened up, it's a real difficult proof standard. And that's why I said in the workers' comp, assuming you can prove it's work related, then you would be covered by workers' compensation. So as Rich said, you need to exercise some due diligence. The workers' comp question is going to take time to run down. The one deadline you have is, and Rich mentioned the reporting to OSHA. You want to make sure you determine, especially on a death, the causation as best you can quickly. And then there's also recordability. And this is where what Rich said is certainly the case. If you've determined it's work related, then you need to record it on your OSHA 300 log, and you have 6 days to get that on there. So that due diligence, the best you can do during that 6-day period. And then if in doubt, you may want to put it on the OSHA 300 log, and then you can ultimately take it off if you determine that it's not work related. But you're gonna have to do some kind of investigation, and it's going to be site specific. Was the person working next to somebody who was infected? Did they have somebody in their household that was infected? Where have they been going? What have they been doing? And you get a little bit into the person's private life as you start to investigate that. If the person isn't telling you anything, you got to do a measure of, well, I've got an outbreak in my workplace. I better err on the side of considering that to be work related until I can prove otherwise. If you've got no other cases in your workplace and the person's claiming it's work related, I think you could err on the side of it, not being work related until proven otherwise.
Yeah, I think this is a really valuable conversation that we're having around, what happens if you do get to some of these not great outcomes, right? If you have unvaccinated people or immunocompromised people, if someone does contract COVID in the workplace. I think those are important situations to plan for, but I also think there's value in reminding employers that if we can get more people vaccinated, that we don't have to deal with those situations. And someone asked a question about what suggestions that you may have for navigating conversations around vaccination requirements with employers. And I would just slightly extend that question and say, what actions can employers take to really reach those employees who are still unvaccinated, who may be shiftable, right? There's this conversation around, we want you to get the vaccine, and maybe people are on the fence. Ultimately, how do you reach those employees so that you can avoid some of these negative outcomes? And maybe Dr. Waddell and Richard Cerenzio, maybe I can hear from the two of you in terms of what your thoughts are there.
Yeah, certainly, Malcolm. So again, I think it's important to, as an employer, to continue to do your part in reminding folks of the situation that we're currently in, that we're not out of this pandemic and that it is still impacting lives every single day, and that we're all part of communities and we all have seen people who have had not so good outcomes. And so as an employer, to do everything that you can to make it easy for someone to access the vaccine. And in some cases, that may even be having a clinic on site, that you may have a facility where that's the case. It could be that, stories are really powerful also, and people listen to trusted voices. And in some cases, those trusted voices may be one of your, my colleagues. And so to the degree that there are folks that may have been on the fence themselves and made a decision to proceed with getting the vaccine, and there's an opportunity to facilitate those kinds of conversations, and someone is willing to share those stories, that's something that you could do as well. But to continue to provide that supportive environment, the information, and yeah, absolutely. I mean, you can't force people to take vaccines, right? But it is important to be as supportive as possible.
And to Dr. Waddell, to your point, sorry, Dr. Waddell, to your point, yeah, we share stories here all the time, and I think it's the best way, especially with the Delta variant, where you read articles of cases where 90% of those sick in Florida are unvaccinated, individuals, and we talk about that informally here at the office. We do not have a formal plan to say this is vaccination day, or we're picking July 30th as everybody go get one and anything like that. But we do have conversations among teams, among meetings that we have, among webinars, among even people. We have a hybrid workforce. So we have the people that are home still that we involve in everything that we do to make sure that that message gets across to everybody, not just the people in the office, but the people that are home because they're home for a reason. They're home because they're uncomfortable. And if we could answer any questions about why they're uncomfortable, we ask. And again, I hate to keep going back to the survey tool that we use, but we survey people, what's great about coming into the office? What's not great about coming into the office? And then what's great about staying home and what's not great about staying home? And we can then give we give the survey feedback back to our employees so they can see that, hey, I'm not alone in this, or I'm not the only one uncomfortable, or holy cow, there's 80% of our people are completely confident in the workplace. Maybe I should go back. So that's how we share the information, very informally, but by more through survey.
Thank you, Richard. That's super helpful. We have a ton of questions in the queue, but only a couple of minutes left. And so I want to try to kind of boil down the remarks that everyone has made over the course of the hour. And so what I'm going to ask of each of the panelists is if you could leave employers with one piece of advice to take away from this session, what would it be? And I'm going to ask you all to keep your responses to as close to 2 or fewer sentences as possible. Maybe Rich Fairfax, maybe we can start with you and just go down the line.
Sure. I think the key thing is the exposure control plan. I think that's important. And whether you're a covered industry under the ETS or not, it's important to get it right. And I'll just offer is, OSHA is happy to help an employer generate that, and a phone call asking for that help will not generate an inspection. I do want to take a real quick point of the covered industries. There's a lot of confusion, but one of them is employers, and ambulatory care facilities, which are, emergency response centers, doctor's offices, dental offices. And just to be clear, if you are a company and you have a health clinic on site where you provide vaccinations or testing or whatever, that unit inside your facility would be covered by the standard. Likewise, if you're a pharmacy, now pharmacies are technically not covered by the standard if you're just dispensing prescriptions. However, a lot of pharmacies nowadays have health clinics inside where they do vaccinations and testing and all that. And if you're a pharmacy and you have that on site, that unit would be covered by the ETS. So I'll stop there, but I just wanted to get that point out because I think people just need to know that, and they're assuming otherwise.
Thanks, Rich. Richard, one piece of advice for employers to take away.
Yes, over communicate to your employees. Be consistent with the message you're putting out there. So if you're calling it voluntary, make sure you keep it voluntary until you change that. And then have empathy for those that don't feel comfortable coming in. Don't pressure them.
And around empathy is so important. It's been proven to be super valuable in all communications around COVID and vaccines. Thank you, Richard. Chuck.
Just because you drop the masking requirement doesn't mean you should scrap everything. Maintain your existing policies. We don't know what the fall will look like. We don't know what the Delta variant is going to do. Monitor your local situation and be prepared to re-implement. It's going to be hard to go backwards. So if you're taking down barriers and you're lowering the social distancing, it's going to be hard to reverse that. So one step at a time. You can drop the mask mandate for unvaccinated people. Even if you do don't ask, don't tell, don't scrap everything else just yet.
Fantastic. Thank you, Chuck. And last but not least, Dr. Waddell.
Yes, and so I would say it's really important to keep that multi-layered approach in place, to have those policies that are supportive of employees being able to get vaccinated and feel supported if that's what they choose to do. But as Chris or as Chuck mentioned too, masking remains important. Physical distancing remains important. So utilize all of those tools that we have in our toolbox that have worked up until this point. Because again, the Delta variant is very serious, and we want to go forward, not backwards.
I think that's a really great message on which to end, which is we want to go forward, not backwards. So I want to thank all of our panelists for joining us today. Excuse me, we have a ton of questions that I know we could spend hours and hours getting to, but I want to be thoughtful about everyone's time. Thank you all for just such a wonderful and really valuable discussion. And before I close, I want to leave you all with just a couple of announcements. As I mentioned earlier, today, the Health Action Alliance and the National Safety Council are launching a decision tool to help employers safely reopen their workplaces. It's both an interactive web platform to help you answer your questions that you may be thinking about when it comes to reopening, as well as a downloadable document that you can share more broadly. You just saw in the chat the link to this new resource, and I really encourage you to check it out. And one more announcement. I want to make everyone aware of a really exciting event that the Health Action Alliance is hosting this coming Monday, July 19th at 2 p.m. Eastern. In partnership with the American Academy of Pediatrics, we're hosting a national business town hall on childhood vaccinations, a point that Dr. Waddell brought up earlier. We'll be joined by a wonderful slate of experts, including Dr. Rochelle Walensky, the director of the CDC, as well as Dr. Lee Beers, the president of the American Academy of Pediatrics. And we'll be launching a new coordinated effort by employers, business groups, and public health organizations to help families vaccinate their kids against COVID-19 and catch up on other routine immunizations. And so we'll be working together with partners to call on businesses to do a lot of the things that have been mentioned in this conversation. Host on-site vaccine clinics for families, provide paid time off, transportation, childcare, or other forms of assistance. And we're really excited to work alongside the National Safety Council in order to get that information out into the world. National Safety Council is one of a handful of businesses that has signed on to this effort. And we're going to be talking more about some of the other businesses that have joined on as well. Again, the information as to how to register for that event is in the chat. And with that, I want to say thank you all to our panelists, to everyone in the audience, and to the folks behind the scenes at both the National Safety Council and the Health Action Alliance, all of whom were integral in making today's event possible. You can always reach us at the Health Action Alliance at hello@healthaction.org with any questions or comments. And we'll be sending a follow-up email, as I mentioned, with resources that we mentioned today, as well as a recording of the webinar. And so with that, I just want to say thank you again, and I really hope you all enjoy the rest of your day. Thanks so much. Take care.